Hi, we're here today to talk about the American Nurses Association's Grand Challenge, Healthy Nurse, Healthy Nation. A grand challenge is a large, bold, socially beneficial goal that an organization takes on to make a positive contribution to society. Marla, tell us about Healthy Nurse, Healthy Nation.
The concept that we have here at the American Nurses Association is to improve the health of the nation by improving the health of registered nurses. We know that we have 3.4 million registered nurses, and we recognize that if we improve their health and take them from below average on health or average and improve their health, that alone will improve the health of the nation. But we recognize that there will be ripple effects from that. So for example, one of the things that we know is that any clinician who is healthy themselves are more likely to talk to their clients about how to be healthy, and when they talk to their clients are more credible. And so that, we believe, will also improve the health of the nation. We also know that registered nurses know a lot about how to be healthy, as do many of us in the nation. So there's a gap between knowing and doing. And so one of the things that we intend to learn is what helps to fill that gap between knowing and doing so that we can begin to spread and share that information.
Well, that's a really big contribution. And when I think about filling that gap between knowing and doing, I think about something that feels Herculean, right? As one of your staff said in one of our meetings once, I'm both enthusiastic, excited, and terrified. Why would the American Nurses Association take on such a big lift like that?
Yeah, that is the definition of a grand challenge. And the whole reason is we want to make a difference in society. We want to truly improve the health of the nation. And when we thought about what are the assets that we have, the asset that we have is registered nurses who both know a lot about how to be healthy and are spread all throughout lots of different places in our society and could really make a difference and an impact on this.
Pam, you've been taking a leadership role with this. Tell us about the value of Healthy Nurse, Healthy Nation to the American Nurses Association.
Yeah, thanks, Seth. We think this is really critically important. You know, our mission is really to enhance and improve nursing in order to improve health for all. And we believe this is a really important thing we can do for all nurses in this country who work really hard every day, sometimes not taking care of themselves as well as they take care of the patients and families that they look after. So we think that this is an important thing for us to do, to really focus on the nurse, provide tools and methods and feedback and recognition for really not only improving their own health, but really improving the health of the nation. We also think that it's an important part of what the American Nurses Association will give back to society. You know, we've always been focused on our social contract with society to not only improve health, but really meet the needs of individuals in many ways. And so we know we can do that with raising the health of the nurses in our country.
What we're trying to do here is create a social movement and change behaviors in a way that is really impactful. So we've invited some partners to join us to begin to dialogue around how do we begin to impact nurses' health by what nurses do as individuals, what they do on an interpersonal level with their colleagues, what they do inside of the organizations in which they work, what they do in their communities. And so really looking at how do we make an impact on all of those different levels.
I think that's really exciting. We're looking at a systems approach, and we're looking at some of the frontiers, people who've gone before us. It's really, I think, an adventure to be at the forefront of something that involves this kind of national level of behavior change.
You know, Seth, the other thing I would say is whenever I've told someone about this grand challenge, whether it's some of our nursing colleagues or whether it's leaders in technology companies or companies that produce healthy foods, they're really excited. They go, wow, that's really a great idea. And so I think that not only are we seeing internal enthusiasm and, again, this great receptivity, but I think people want nurses to be healthy and they want to hear from nurses. And so I think this is, again, another really big step forward that is a great legacy for us to pursue.
One of the approaches that we're using as we're doing this grand challenge is recognizing that we want each and every employee at ANA also to be as healthy as they can be. And so while we're doing this work for our members and for nurses out in the world, we are simultaneously looking at how do we create healthy employees here at ANA? How do we do that work on an individual level and interpersonally and collectively as employees working with each other? And so we have some initiatives around how we ourselves can be healthy.
So I imagine that that touches all points of an employee's life. I mean, it's everything from how they get their work done to how they take breaks to how they care for themselves nutritionally, spiritually, physically, all of that. Is that right?
Absolutely. Whether they're taking their vacation time or not, what they're doing on their time off, how to create that true whole wellness. And we want each person, wherever they are in their level of health, to be even a little bit healthier. We all want that in our lives, and so we're looking at how can we apply the learning that we're having out in the world as we do this initiative to our own selves.
I think the beauty in that is that ANA really tries in every venue to live its values and mission, and so it's just as important as we face our public and our nurses that we have the same message to our staff. And we talk a lot about a healthy and ethical work environment, and so this is really, again, another way to live that commitment with our staff.